Hey everybody, thanks for joining me today, Dr. Ross Marcagiani with another great conversation at Turnpaugh Health and Wellness Center. Today we're going to be talking about mast cell activation syndrome, or MCAS for short. We'll be diving into what is a mast cell, what happens when too many mast cells are being produced, signs and symptoms, how to test, and how we downregulate mast cell production. Let's dive in. So first, what is a mast cell? So a mast cell is part of the immune system. It's in response to an antigen that's coming into the body and causing an inflammatory response. Mast cells are typically made in the bone marrow. Okay, they're made in the bone marrow, and they're first produced as a mature B cell. We'll talk about that in a moment in more detail. But what happens is these mast cells are produced. And when they're produced, they help to regulate vasodilation. They help to regulate the vascular homeostasis, the innate and adaptive immune response, and angiogenesis, which we'll talk about in just a moment. What happens with these mast cells is that they basically, something happens in regards to an inflammatory response in the immune system. The mast cells will travel as progenitors in the bloodstream. So a mature mast cell can't travel in a bloodstream. It will basically travel as, think of a baby mast cell. So it travels through the blood and it goes to a site of inflammation. These main sites are going to be sites of connective tissue, sites that have blood cells or vascularization or blood vessels, smooth muscle, mucous membranes, and hair follicles. So to connect the dots even further, your stomach and your digestive tract and your respiratory tract have a lot of smooth muscle and mucus around it. Connective tissue is basically our entire body, like joint pain or skin issues, because these mast cells will sit just below the epithelium, our skin, which is our skin, in the connective tissue. It can influence the epithelium and influence hair follicles. Those are the big areas there. So they'll basically, again, travel through the blood, and then they'll go to one of these various sites we just talked about, and they'll be influenced with a stem cell factor or a cytokine. It's then where they mature into a mature mast cell, and at this point, they will be triggered to release various inflammatory markers. Most commonly, people know or recognize mast cells releasing histamine. They release various markers, heparin, various cytokines, various eicosanoids, which we'll talk about in a moment. But they release this histamine, and the histamine allows whatever is being targeted, that cell or structure, allows it to be permeable. It allows things now to enter into that cell or that structure, mainly being white blood cells, which now can come in and kill the antigen, which could be a pathogen, a bacteria, a virus, it could be a food allergen, it could be a mold, it could be a mold spore, it could be a chemical. Various antigens can stimulate or upregulate this mast cell production. So that's basically what a mast cell does. Goes to a site of inflammation, causes the releases of histamine, degranulates the mast cell, and allows for the immune system to come and kill. But what happens when we have overactivation of this mast cell? So we'll go in a little bit more detailed here. So what happens is it travels through the blood, the progenitor travels through the blood, goes to a site of inflammation. And basically what happens here in this diagram, the Fc epsilon Ri is really just considered an IgE receptor. So what happens is an antigen binds to that IgE receptor, it degranulates, and it releases these all of these inflammatory markers, which I just previously mentioned. But just so you're aware of it, releases TNF alpha. We talked about histamine. It releases tryptase, kinase, various amines. the eicosanoids, which we mentioned, the leukotrienes and prostaglandins, and various cytokines and chemokines and other growth factors, interleukin 4, interleukin 5, 6, etc. And there's also, just so you're aware, there's two types of mast cells. There's mucosal mast cells, which just release tryptase, and then there's connective tissue mast cells, which release tryptase, kinase, and carboxypeptidase. Just some fun facts there. But what happens is when we release all these inflammatory markers, we allow the immune system, it stimulates, it triggers the immune system to come and kill. Specifically, it causes the interaction of interleukin 4 with this mature B cell. So we talked about that progenitor cell. So that B cell is basically what that is, and it will interact with a Th2 cell, the killing side of the immune system. Typically, it interacts with interleukin 4, and it causes it to become a mast cell. So when we have a lot of Th2 side of the immune system, the killing side of the immune system, it causes for us to have more killing and more inflammation. And we kind of end up in this vicious cycle of more killing and more inflammation. So that's what happens when we have too much mast cell production. It just kind of keeps this vicious cycle of inflammation and killing going by the release of these various cytokines, chemokines, and various inflammatory markers. So signs and symptoms. So we talked about here where mast cells mainly are stored. They're mainly stored in the GI tract, the respiratory tract, in the skin. Remember, they line mucous membranes, they line smooth tissue, they line connective tissue, smooth muscle, they line connective tissue just below the epithelium, so they can affect the digestive system or the gastrointestinal tract. They can cause, when mast cells being released, it can cause vomiting, it can cause diarrhea, it can cause skin reactions, it can cause acid reflux, because when we have the release of histamine in the digestive tract, it stimulates acid production. Why these can be released? They can have, if we are having inflammation in the stomach by a parasite, a bacteria, if we have a food allergen, whether it be gluten, dairy, or another protein that's causing this inflammatory reaction. So that's something that people don't realize when they have a lot of inflammatory reactions. It could be driving mast cell activation. In the respiratory tract, we have increased mucus production, airway constriction. We can have excessive coughing, allergic asthma, sinus infection. So if that antigen, whether it be a mold spore or a pollen or a various bacteria, and it gets caught in the respiratory system, it can cause that inflammatory response to signal mast cells. In the skin, remember we talked about that the mast cells are in the connective tissue just below the epithelium, so it can cause hives, it can cause edema, because again, the blood vessels are close to the skin, and the blood vessels are also close to the digestive tract. So we can have basically increased fluid retention in the vasculature, creating edema. We can have dermatitis, we can have eczema, again, close to the skin. We can have hair loss, again, close to the skin, and can influence the epithelium in the hair follicle. So some testing here. Main ones would be serum histamine, serum tryptase, N-methylhistamine, which is a urine sample, MSH, which is melanocyte stimulating hormone. We have chromogranin A. We have DAO, which is diamine oxidase. This is an enzyme that helps to break down histamine. We have C4A. We have PGD2, which is prostaglandin D2, which is one of the inflammatory markers that's released by the mast cell. We have interleukin 4, interleukin 6, Those are more related to the Th2 side, the killing side of the immune system. So we're seeing if the mast cells are upregulating that side of the immune system. And there's much more. A new test that came out is something called a mito swab, which is giving us a lot of good information to looking into mast cell activation syndrome. Something to be aware of. This is mainly for practitioners, but just good to know. If we have high tryptase levels, let me back up a sec here. So tryptase can be produced by mast cells. Again, remember how we talked about there's two separate types of mast cells. Each of them have tryptase in them. But the key here, the reason why we want to be conscious of this is because remember, mast cells or mature B cells are made in the bone marrow to become mast cells. And if we're having increased mast cell production, we could possibly be having bone marrow expansion or bone marrow growth, which could lead to possibly some type of cancer. Most commonly, we see mastocytosis, which typically you'll see it affecting the skin, but it can become a cancer. So running a blood or urine serum electrophoresis helps to rule out if that's something that you should be concerned about. So how do we downregulate mast cells? So the key factors here, we want to address the inflammation and we want to address the killing side, right? Those are really important, which is the immune system. But what is driving that inflammation? What is the antigen? So we want to remove the antigen. Again, whether it's a food allergen, whether it's a bacteria, whether it's a parasite, whether it's a mold, whether it's a virus, removing the antigen so we're no longer stimulating inflammation, which drives that mast cell. We want to make sure we regulate the immune system because we're doing the constant killing. We're constantly activating the Th2 side of the immune system. So we want to downregulate that and balance more of the Th1 side of the immune system. So the Th2 side, Th1. Both are very important, but we just want to have a synergistic and balanced ratio of the two. We want to make sure that we improve detoxification. If we're having all this inflammation or we don't want circulating inflammatory markers. So we want to make sure we're removing these inflammatory markers so we're not constantly in a state of inflammation. So that obviously is removing food or removing inflammatory foods, whether it be a gluten-free diet, dairy-free, removing various grains, removing various proteins, which could be dairy, whey, and casein typically is a protein that's very inflammatory. That's really important. That involves addressing the inflammation, using turmeric, using SPMs, which are resolvins, which helps address the inflammation. We're going to make sure we detoxify, whether it's an ALA with NAC, with glutathione, whether we're using milk thistle or other sulfur amino acids is really important. We have vitamin C, which is, as most people should know, is an antioxidant, a powerful antioxidant, which helps to reduce inflammation. We have other supplements that can downregulate the histamine response, such as quercetin, berberine, we have stinging nettle, we have 2 probiotics that are really important to downregulating histamine response, which are lactobacillus rhamnosus and bifidobacter. So these are all things that we can do to downregulate that mast cell activation. So remember the key points here: reduce the inflammation. We have to reduce the inflammation by removing the antigen, whatever that may be, and also normalizing or balancing the immune system. Those are the key factors. I hope you learned something from this. If there's anyone that you know can benefit from this, please share this video. My main goal here is to make sure that I'm providing information to make informed decisions on your health. Thank you for your time and have a great day.